Long COVID. Cough. Coughing is the body's way of protecting the lungs and getting rid of things that irritate them. This is a normal and important function. Types of cough. Some infections can leave you with a dry cough because your lungs have been irritated. This should slowly disappear during the course of your recovery. It's not clear how long after coronavirus, COVID-19, you may have a cough, and it can be frustrating at times. A dry cough is one of the most common coronavirus symptoms. But some people may have a cough with phlegm, thick mucus. It can be difficult to control your cough, but there are a few ways to help. Ways to help a dry cough. Do. Keep yourself well hydrated by drinking small amounts often throughout the day. Soothe your throat by drinking a warm drink, such as honey and lemon. Take small sips of liquid if you feel yourself starting to cough. Suck a sugary sweet if you feel yourself starting to cough. Try swallowing repeatedly if you have a cough and don't have a drink near you. Blow your nose if you have a runny nose. Try not to sniff. You can also use positions to ease breathing if you cough when you go to bed. Avoid things that make you cough, for example, smoking, smoky atmospheres, air fresheners, strong-smelling candles, strong perfumes or deodorants. Ways to help a cough with phlegm. Do. Stay hydrated. Inhale steam. Try lying on either side as flat as you can to help drain the phlegm. Try moving around to help move the phlegm. Try breathing control techniques if you move to an area with a different temperature. Try to breathe in through your nose. Breathing in through your mouth can make you cough more. Speak to your GP practice if your cough is not improving. You're waking up at night coughing. Your cough is changing, for example, coughing up blood or phlegm turning dirty. Breathlessness is not improving. You're worried about your symptoms.